Hello, everyone. Thank you for joining our special broadcast session Tete-a-Tete on Voice of Healthcare Network. My name is Koustav Chatterjee. I'm a principal at Frost & Sullivan's Global Transformational Health Practice, and I'm here to welcome Dr. Sujit Chatterjee, CEO of Dr. L.H. Hiranandani Hospital, Mumbai, India. This hospital is a 244-bedded super specialty hospital located in Hiranandani Gardens, Powai, Mumbai, India. Dr. Sujit Chatterjee has led the Hiranandani Group to arguably the first public-private partnership in healthcare with Navi Mumbai Municipality Corporation. Dr. Sujit Chatterjee's area of specialization include obstetrics and gynecology and gyne-oncology. He was a doctor in the armed forces from 1976 to 1999. He was also a professor of obstetrics and gynecology at Mumbai University since 1991. He was elected by the armed forces for super specialization in gynecological oncology and trained students in preventive oncology and all related healthcare intervention and chemotherapy. He has also won many awards in his career that include Chief of Naval Staff Commendation Medal for outstanding services rendered. He has also published papers in various scientific journals and has won awards for the best scientific presentation. Dr. Sujit, it's an honor to welcome you to this very special episode powered by the Voice of Healthcare Network.
Thank you, Costa. I'm delighted to be here, and thank you very much for that warm introduction. And I'm very pleased that you've thought of me to be in this show today. Thank you.
It's my honor, sir. So, our big goal today is to propagate your immense experience and wisdom and blaze your knowledge across the building healthcare community with the purpose of helping them nurture and grow, following your footsteps. We will be having a very free flowing chat, and our audiences and viewers are eager to know your esteemed views. And so, without much ado, let's begin. And let's start with stressing upon the fact that which is trending today, which is the new normal after COVID-19, and how it has forced all of us to bring that much needed shift in our system. And for that shifts in healthcare industry to happen, we all know that we need to accelerate our adoption of various enablers. That could be in the form of technological advancement. It could be in the form of consumer adoption of healthcare information technology for medication management, for care management, for precise preventive intervention, and finally, the need for regulatory policies for an overarching population health management framework. So, what we aspire to learn from you, from your thought leadership and experience in this field for decades, is which are these enablers that you think would be highly prioritized after COVID-19?
See, as far as I think what is going to come to the fore is that during the or COVID or during this time, I have found that people were generally frightened of contacting COVID in a hospital. And hence, we saw a steep decline in the OPDs as well as IPDs, as well as the routine cases that we were doing, for example, a joint replacement, etc. People were deferring all of this. Now, it's not that you will not fall sick. Sickness, illness can come to you at any time. So, therefore, we embarked upon this concept of telemedicine, which many people have perfected. We in our hospital had started this during the COVID time. And we found that there was a huge response from people living in and around Powai, because that's basically the people in and around Powai look upon us as the first place to go to if they are unwell. And this is the only place that you can't come to because you're so frightened. So telemedicine started helping us. We had a lot of struggles for payment gateways. It was not that simple. There was confusion. People who paid couldn't log on. But all of this was perfected in time. And today I find that while people are slowly coming back to the hospital, but it is so much more convenient when you have your parents staying with you. You see, we are not yet a nuclear family nation. We do look after our parents. Now, I find a lot of youngsters who are working in eminent companies like yours still have their parents staying with them. And these youngsters are frightened to bring their parents to the hospital. So, therefore, the geriatric population or the seniors, like me, uh, uh, are taking the telemedicine consultation. Now, along with the consultation, the good part is that we can even mail you your prescription. See, so for prescription, you don't have to come to collect in the hospital.
Yeah.
You can take that prescription, send it to by mail or even to by WhatsApp to your nearest chemist who will drop the medicines in your house. So this is an enabler
Yeah.
and a good one
Yeah.
and a very good one.
Right.
The second point is we are exploring, we have been watching the Israelis. They have moved ahead as far as, advancement in screening is concerned. So we've been watching the Israelis for some time and we are in touch with the Israeli Trade Commission
Okay.
to get devices by which a person comes to your house with a box, leaves it outside your house, and just like you have food being packaged and put at your doorstep, and somebody rings the doorbell, and you come and take your food because you've already paid online. Now, this package comes to you, but the person doesn't go away. He stays at a distance. You take that package, and you will find there's the stethoscope there, and the doctor's online. So he tells you, put it here, and he listens to your sound, breath sounds, and you put it against your heart. He listens to your heart sounds. There's even a camera,
Yeah.
and you can open your mouth, and he can see your
Yeah.
oral cavity, etc. So it becomes a huge plus
Yeah.
for the doctor to be able to find out what is your current condition.
Right.
And COVID, I stick to COVID, is a disease which really hits your lungs hard. Of course, there are sequential organ failures which can occur, but the first hit is to your lung. And if the doctor can hear your breath sounds, what better diagnosis, method of diagnosis can you have? So it's something that can really be done, and I think this is the second enabler.
Okay.
The third enabler that I think is going to happen is that people are going to be wanting a method by which they can access records,
Hmm.
access investigations, their
Yeah.
reports, etc., while being at home,
Correct.
and even being capable of sending those images in sequence
Yeah.
across boundaries, geographical boundaries, to various places for a second opinion. Why not? If the best cardiovascular thoracic surgeon is in Mumbai,
Yeah.
and of course, Mumbai doctors did operate on the Prime Minister, Mr. Manmohan Singh.
Right.
So, well, I mean, I am a Mumbaikar, so I take credit, and I'm very proud of the fact that Mumbai, did the job.
Of
But the
course.
fact of the matter is, if I had a 2D echo and I wanted to stay in Mumbai and send it across to Delhi at the All India Institute or
Yeah.
wherever in Vedanta or whatever,
Right.
I would be in a position to send it, knowing full well that there would be a sequential representation of my tests and not jumbled, so that the doctor is completely confused and he says that, look, either you fly down over here
Yeah.
or I won't be able to tell you anything. So I think this is going to be another major enabler. The point is that today we have to do a lot by way of preventive care. And the digital media is one in which, via which you can actually reach out to a humongous audience,
Yeah.
and tell them exactly what they want to know.
Sure.
Webinars, webinars are going to be, the way forward, be it
Yeah.
scientific, be it
Yeah.
preventive, be it educative. It is
Yeah.
going to be a huge enabler because people want to listen to experts. But
Right.
how am I going to get 1,000 people into my hospital? I don't even have an auditorium big enough for 1,000 people, even if they
Sure.
wanted to come.
Sure.
So here I've got an enormous reach. For
Yeah.
example, tomorrow is the World Mental Health Day,
Yeah.
and I'm having a topic with all my consultants for the people. Now, I am going to get at least 400 people listening to experts
Yeah.
and even asking questions about how they should take care of their mental health, which is an
Yeah.
enormous help.
Absolutely. Completely agree with you. Yeah.
So therefore, this is the way forward. And
Yeah.
the faster we accept this,
Yeah.
the faster we show the results on ground by publishing data that I had so many patients online and I was able to diagnose and send correct advice to the patient, and I avoided them coming to the hospital, would
Yeah.
release a lot of institutional capacity, let me tell you. That's
Sure.
one.
Yeah.
Second, second would be that it doesn't affect the business.
Correct.
So therefore, the patient is paying you.
Yeah.
The patient is comfortable.
Yeah.
The patient got the right advice. I'm not saying
Right.
about surgery. Say, sir, a person has to get admitted to the hospital. Please don't get me wrong, that this will also help out in that realm.
Yeah.
No.
Yeah. Yeah.
But the majority, if there are 100 people who want to consult, only 10 will require admission or
Right.
operative. The
Yes. Yes.
90% would be tackled in this particular manner. So, therefore,
Correct.
this is the way forward. And these are
Absolutely.
the enablers I think we are going to see enormously in the future.
Yeah. So I'm completely aligned with your perspective here, and I have a couple of questions to follow up with your perspective. Number one is, you talked about the fact that digital enablers will completely transform the way healthcare is delivered in India in future. But speaking about acceptance and adoption of digital enablers, do you think, in your opinion, healthcare consumers in specific are ready to adopt digital enablers, especially advanced digital enablers, to communicate with their providers across the care continuum on near real time?
You have to see the value, sir. Let me
Yeah,
tell you, 15 years ago, you didn't have smartphones, did you?
correct.
But who uses the maximum smartphones in the world? India.
Indians and rural Indians included.
And rural Indians included. So,
Yeah,
therefore, if you are able to give a value proposition to the Indian
yeah,
who is a smart individual,
right.
they will adopt it
Yeah,
and you will have it across the board. Do not be fooled by rural India, sir. The
correct.
rural India, if you have to go to vote, he will take your money but vote whoever he wants. So he's got to have a value proposition. So if you can
Absolutely.
create a value proposition, sir, imagine somebody sitting at Chhattisgarh
Yeah,
or sitting at Gorakhpur
yeah,
and consulting with Dr. Hiranandani Hospital
correct.
and getting some advice.
Yeah,
Let me give you a small example.
sure.
Small.
Yeah,
A person from Mumbai, like you, a corporate person, kept getting irritation in the eye. And many people subjected him to eye drops. I keep eye drops. So therefore, eye drops, this drop, that drop. Don't look at your computer screen. Now, today we are all dependent on the computer screen. So how long are you going to stop this?
yeah,
But the ophthalmologist said that, can you come close to the screen? Can I view your eye? Can you open it?
yeah,
All happened online. And
yeah.
we got them to get investigated. And we found that individual had a syndrome called Sjogren's disease.
Okay.
which gives you dry eyes and gives you less salivation.
Yeah.
Diagnosis made online. Blood tests done, proven the diagnosis.
Correct.
See how much of the effectiveness.
Yeah.
So therefore, that's what I'm talking about. Give a value proposition. So if
Right.
you, sir, and your eminent company are going to be able to do this, then I think we should be even contacting people at Gorakhpur and the Ladakh, for that matter.
Yeah.
You see, sir. So therefore, everybody wants to see a value proposition, and it depends on how we put it across and how these things will come into the future.
Absolutely. And I think from regulatory policy standpoint, we now have the incentive in place to also adopt more telehealth enablers. Because just few days ago, I came to know that the regulatory agency that is overlooking the insurance industry in India, the healthcare insurance industry in India, is now accepting telehealth visit as a pure play format of reimbursement. So if I am an insured person and my premium includes the telehealth visit, then I don't have to worry about paying amounts on telehealth visit. Because I had this experience. A couple of my friends from rural India were cheated by hospitals. This is a controversial topic. Maybe we're getting into something different. But then, because you mentioned the possibility of telehealth becoming a mainstream technology across India, it's also important for us to highlight where the bottleneck is currently. And the bottleneck is for people who are not really aware of the value proposition of telehealth. They are, falling, in a trap of a kind where doctors are charging humongous amount of money by providing very basic first aid treatment for a few seconds and charging 2,000, 3,000 rupees per visit. And these people, because they don't have any other option but to go for that particular visit, are paying that amount to get certain kind of medication or prescription refilled. So I had this experience from a couple of my friends who reached out to me, complaining that we reached out to this hospital and that doctor prescribed us the same medication my father was taking for 6 months now. He just came on a call, 15, 20 seconds, he listened to my father and gave the same prescription. And he said, okay, continue with the same medication. He charged 1,200 rupees for a 1 minute visit. So this financial aspect of telehealth is also important to consider from consumer standpoint. From provider standpoint, it makes complete sense. From business standpoint, it makes complete sense to expand the network of telehealth across entire India. But I think we also need some intervention in place to ensure that there's some regulatory oversight as to how providers can charge fees from these patients and providers. Do you agree with that notion?
Yeah, well, I mean, that's part and parcel of fairness. That's part and parcel of fairness, really. I mean, look, just because somebody has a disease for which they
Yeah,
require to continue treatment, and you
yeah,
come to me as a follow up visit, you're
yeah,
not really going to get 40 minutes of my time.
sure,
You're going to get 5 to 10 minutes of my time
sure.
because I already know the disease. I know that this will help you. But you see, if we are sitting across the table, then there is a tendency to ask more questions. You get familiar with the patient.
Yeah,
There is a body language which you engage in.
yeah,
So those sort of things have now to be translated into the digital format. So
correct.
what I'm saying is there's going to be a cultural shift.
Yeah,
The cultural shift is going to be on both ends. The cultural
correct.
shift has to be for the patient who has to accept a new norm.
Yeah,
And it has to be also for the professional who has to understand that the old is passe and there is a new norm for which they will have to adapt. So the
understood.
adaptability, things like this take time to mature. It's like
Yeah,
saying that I have started a new business and why am I not making profits in the first month of my starting the business?
correct.
So there's a new norm which has to be adjusted by both sides.
Both.
Now, you may have a bad experience, but I have people who've had COVID, they've
Yeah,
gone home, and they want a telemedicine consult. And that
sure.
telemedicine consult has gone on for 25 minutes. And they've
Yeah,
been asking about, and the doctor is trying to ensure that he picks up the finer nuances of COVID complications.
Yep. Yep.
So therefore, he's asking repeated questions, so much so
Questions.
that he gets irritated. And why are you asking me the same thing?
Same
He
thing.
wants
Yep.
consistency of the answer.
Yep. Yep.
See, so therefore, what I'm trying to get at is that there's a new normal,
Correct.
but it will require a little time for the maturity level for both
Yep.
ends to set in.
Agreed. Okay, so moving on to something different, keeping aside the COVID pandemic for a while, let's also discuss about the new paradigms for infrastructure, geographic distribution, providers, and care settings in the field of Indian healthcare. I guess my question is around the need for complete digitization of Indian healthcare delivery. And in your opinion, what are the steps that Indian healthcare needs to take in terms of either approaching local companies to get those services done or at least collaborating with international players who did this very successfully over years for mature markets like US and Europe? Do you believe that there is a scope in the Indian provider landscape to engage with global healthcare information technology companies to completely modernize the digital healthcare infrastructure within the hospital system and outside? Or do you believe that Indian healthcare industry has enough digital health participants who are local and homegrown in nature can address those needs in near term?
What's wrong with Indian healthcare? I mean, what's wrong with Indian information technology? Half the Silicon Valley is full of Indians. So why do we
Correct.
need to engage with, the likes of Donald Trump? We shouldn't be. We should be engaging with our own people
Right.
and the Wipros of the world. And there are so many other massive Indian companies who
Yeah.
can transform this. And the transformation of, you mentioned completely,
Mhm.
complete transformation is not going to be foreseeable in the near future, but in steps, it's going to happen. It's already happening.
Yeah.
Electronic medical records are not something very strange. All of us are familiar with electronic medical records. It is the use,
Correct.
the user acceptance. There are certain things that electronic medical records make difficult, for example, the use in the ICU. So,
Yeah.
therefore, whatever you can do, if you perfect it, you feel very comfortable with it. For
Yeah.
example, in
Yeah.
my ICU,
Yeah.
since there was this COVID pandemic and we were having many cases, we
Yeah.
thought that we would, people would be more comfortable writing. Do you know the nurses protested? The nurses said that please don't stop the EMR because we find it inconvenient to indent.
Okay.
So the indent is much faster if you do it online
Hmm.
than if you had to send it by, snail mail. So they stopped us. I'm telling them that you can go back to your old. He said, no, this is much faster. So please don't stop this.
Correct.
Please continue it.
Continue.
And who said this? The nurses.
Nurses.
So therefore,
Yeah.
the young doctors are utilizing all of this.
Correct.
It's
Correct.
all being utilized.
Yeah.
So maintaining patients' record electronically
Yeah.
is nothing new. So therefore, I think these things are going to advance. But
Yeah.
the product should be one,
Yeah.
easy to get used to. That means people say user friendly. Well, everything can't be user friendly. I mean, you have to have the enthusiasm to want to accept it. If you don't have the
Correct.
enthusiasm to accept it, then no matter how friendly I make it, nothing's going to happen.
Yeah. Yeah.
But what I'm just trying to get across to you is that people are seeing value in it within
Yeah.
the healthcare system.
Correct.
And
Correct.
my nurses are basically 95% of my nurses are from Kerala.
Kerala.
And they are from the interiors of Kerala.
Hmm.
So therefore, they wouldn't be the ones who are experts at electronic medical records or the electronic or the digital platform usage,
Yeah.
but they are the ones who stopped me. So you imagine this. So I
Correct.
think we are on the right track, but certainly not Silicon Valley. Oh no. And we are good enough. We are good
No,
enough.
I agree with you. I've been working very closely with local startups for 3 years now, and I'm amazed by the innovation and the agility of local technologies made to ensure that we address the local problems. Sometimes we believe that a US centric solution or Europe centric solution can address all our Indian problems. That may not be the case because their workflows. I've actually had demos from some of the leading global multi-billion dollar companies, and I saw that their workflows are very Western, very US centric, that need not address the workflow needs of a physician working in a Mumbai hospital or in a Kolkata hospital. So, for a hospital that is looking for a very precise, customized application that can be trained to physicians very quickly with local formula, local workflow, I completely agree with you. We can trust our local vendors and put our trust to them in terms of enabling them to accept that technology and then obviously give them the opportunity to do proof of concept studies in hospitals, transfer your data points to their platform to ensure how your platform is working ultimately,
Yeah.
whether it's improving patient outcomes or not. So I think we have a road in front of us. We have to take that road together. Provider and healthcare IT vendor need to work together to ensure that we are successful in this endeavor. Now, I'm again shifting this conversation to something not related to your professional background, but rather you as a personality. I have a lot of questions to ask because I'm very young and I've just spent 9 years in this industry, and I have intention to continue for the next 25 to 30 years in this field. So having this opportunity to learn directly from you. So I just want to know, in your illustrious career, what are the different things that motivated you to continue your journey in the Indian healthcare space, which is sometimes in different perspective, different point of view, very tough to operate in. As a leading physician, you always have this opportunity to go to abroad and practice in an internationally reputed hospital, but you stick to this, spend a lot of time in armed forces and treating our armed forces, etc. So just trying to understand what motivated you for so long.
Well, I'm a second generation doctor. I come from a family of doctors, and my father was also in the armed forces. My sister is in the armed forces. So we're, very comfortable being in the armed forces. But at some particular time in life, you reach a crossroad, and therefore, I reached a crossroad in my life, and I left the armed forces and I joined the infrastructure leasing and financial services, which was a real hard training ground for me. It was We were involved with large healthcare groups planning their future, and I got into design of hospitals and running hospitals, etc. So it became a second learning from me. So I moved away from obstetrics and gynecology, gynae oncology, and I came into this arena, and I'm quite happy with it. As far as going abroad is concerned, you see, we are ordnance factory manufacturer. All my life, I've spent in the Armed Forces Medical School in Pune. I'm a product. My post graduation was there, and I have a stamp that is made in India.
Yeah.
So therefore, I'm not going to let go of that stamp. It's a permanent branding, and I'm very proud of it. So therefore, that's what promoted me to, not look at any golden opportunities anywhere. I found the gold right here in this country and my city of Mumbai.
Glad to know that. Being a fellow Indian, nothing delights me more than to know that I have someone to look up to who spent all his life treating Indians and improving the Indian healthcare scene, and continue to have that same belief that if we focus on local vendors and local providers, we can continue to improve our population health. So thank you for that perspective. Another question that I had in mind was about that one thing that you have in your bucket list, which you still want to achieve in your life after achieving so much. Is there anything that you're still looking out for and trying to capture it?
Well, at this particular point in time, it's very pertinent that you ask me this. We are faced with a pandemic, and
Yeah.
it's not that my people have not fallen sick. Huh?
Right.
So my one thing that I have in my heart, very deeply etched, is the fact that I want to take my troop across the finish line, nobody to cross the Great Divide, and I want to take my troop intact at the
Yeah.
end of COVID, or what can be considered as its end, so that all of us look at a healthy and a bright future. That's something that engages me terribly at this particular point in time. And that's the only thing that I'm really looking forward to, that I take my truth across.
Sure. And the final question is about any inspiration, any mentor or idol that you look up to as you build your career further.
Oh yes, all of us have mentors and idols. As a human being, I thought the person that I'd love to emulate is my father. But on the
Yep.
professional field, there's no one I would like to emulate other than Dr. Hiranandani, in whose hospital I'm so privileged to work. Who is a ENT specialist extraordinaire and a human being of
Yep.
extraordinary professional skill. So I
Great.
think these are two people in my life.
Good. Thank you. Thank you for that. So I wish we could go on with this truly engaging discussion, but unfortunately, that's all the time we have for today. Thank you, everyone, for the wonderfully illuminating session that we have, and thank you, Dr. Sujit Chatterjee, for your precious time. I'm sure the points and themes we touched upon today will provoke a lot of questions, deliberation, ideas for healthcare providers in India and abroad. And our viewers and audience, like me, are grateful to you for sharing your precious time again and your opinion with us. Dear viewers, that's all for today. We hope you enjoyed our discussion. Till the next time, that's a goodbye from my end. Koustav
Thank you
Chatterjee.
so much for having me on this show. Thank
Thank
you
you.
again.
Thank you. Thank you.